The country reports 539 new coronavirus cases. This breaks the March 31 record for the biggest single-day increase. Total infections now are at 15,588. Of this number, almost 3,600 people have recovered, while more than 900 people have died. Cases also spiked the last 2 days, and the health department attributes it to the opening of 3 laboratories, test results of returning overseas Filipino workers, and newly validated cases. The agency says it takes 3 days to verify patient information before they are listed in the official tally. Now, to explain to us the numbers, joining us now live via Zoom is COVID-19 National Task Force Special Advisor, Dr. Tony Leachon. Good morning, Dr. Leachon. Thanks for joining us. Doctor, can you please explain to us the continuous rise in cases? Because yesterday we had the biggest surge with 539.
Morning, Ria. Well, the 539 cases, the highest so far, may be attributed to the backlogs, delays in submission, that's number one, the manual verification process plus the validation process. Now, they're shifting right now to the COVID Kaya, which is a application of the DILG together with the Department of Health. We noticed that before, it was not really real-time and granular data. But when the DILG worked with the Department of Health, we're using the local government units submission together with the DOH to craft a real-time and granular data with more testings and the coming of the arrival, of course, of the OFW. This contributed. 2 days ago, it was 350 and then 380. So the 539 case, so far, I would say it's an artificial rise, and this will be corrected. Now, if the citizens are actually worried, the other parameters that we're doing right, that's why we're shifting from MECQ to GCQ. These are the following good metrics. The doubling time is about 10 days, and that's good. The growth rate has been down. Uh, New recoveries and the death rate has been down to 17 or from a single digit a few days ago. Now, as you compared our population with big cities like New York with 19 million population, and you have 60,000 deaths. Lombardy in Italy, it's about 16 million, and you have 32,000 deaths. National capital region, you have 16 million, and we have a less than 1,000 deaths at 921. So the metrics for the health metrics actually from shifting to the GCQ is the number one criterion is actually reduce of the viral spread, and we're doing all right. And as we improve and ramp up the healthcare system capacity to detect, to test and isolate and treat every other case, this will be our target this time. And of course, with recruitment of contact tracers, we'll be able to reopen the economy and maintaining, of course, the social distancing measures. So we would try to reduce also the outbreaks in the hospitals and prepare ourselves for the second surge, which will be coming, of course, from our OFW. From the OFW, we have 500 positive cases, and these are asymptomatic out of 24,000, which only contributed to 2% positive rates. So the rest of the 7,000 backlogs, so we have 7,000 backlogs. This will be finished in less than a week, and then we will reintegrate into the real-time and granular data that we're doing right now. So moving forward, we'll be able to uh, give the Filipino people the real-time and granular data as we move forward towards the new normal.
Doctor, do you think, considering that cases are still rising, do you feel that Metro Manila and other areas with high cases are truly ready to shift to general community quarantine, especially since in terms of testing, we're not quite yet at full capacity, right?
Right. So what we're doing right now, Ria, is to drill down to the barangay level using a graphic information system and granular data. And we are setting certain criteria or metrics that if the cases will go up right away, let's say 2 cases per 1,000 population in one barangay, the local government units should be able to clamp down again and revert to a MECQ or an ECQ depending on the situation. Um, they will Secretary Anyo and Secretary Galvez will meet with the local government unit in a Zoom meeting in order to prepare the country on June 1 so that we don't have any problems during the opening day of the GCQ on Monday. So rest assured that we are in control of this. We have flagged down the 539 cases and we are ready. Today, the UP system led by Dr. Ted Herbosa and Dr. Mahar Lagmay will meet with the EXICOM, the Department of Health, so that we can discuss on how to correct these backlog cases. And rest assured that we're doing well with the other parameters, and we will update the country as soon as we actually finish with all the backlogs of the Department of Health.
All right, thank you so much for your time this morning, Dr. Tony Leachon of the COVID-19 National Task Force.